Just wanted to say, just welcome everyone. My name is Anthony Schiavelli. I'm the assistant superintendent of this facility, the Western Mass Recovery and Wellness Center. And just on behalf of myself and all of our staff, just welcome everyone. We're so pleased to be celebrating 1 year anniversary of the Stonybrook Stabilization and Treatment Centers with our sites in Ludlow and here in Springfield behind us. And you know, the Hampden-County-Sheriffs-Department has been providing substance use disorder treatment for a good part of 4 decades. This facility alone, the programs run out of here and previously at Howard Street, have served well over 18,000 men and women, dating as far back as 1985. And we're so fortunate to be led by a sheriff who's such a ferocious advocate for people struggling with addiction. A sheriff who saw a community in crisis, a sheriff who saw a need for treatment beds, who took action and delivered 117 beds for men civilly committed to Western Mass. So please help me welcome our sheriff, Sheriff Nicholas-cocchi.
Thank you, Anthony. Ferocious. Okay, I can deal with ferocious. I just wanted to take an opportunity to welcome everybody. We're here today to mark the 1 year of serving the citizens of this Commonwealth in our Stonybrook Stabilization and Treatment Center, and to honor the memory of those individuals who did not successfully navigate their addiction issues. So if we could, please take a moment of silence for the folks that we've lost, our loved ones. Thank you. I am very proud to say that we've had the opportunity to help more than 860 people struggling with substance use disorders, and we've done it with evidence-based treatment, compassion, and follow-through. I'm extremely proud of the great work of our staff who've engaged daily to transform lives and to become change agents in this region of the Commonwealth. I am thankful that the state legislature that stands with us today and Governor Baker also support our approach to addiction treatment, as evident by the new $1 million line item approved in this year's new state budget for the Stonybrook Stabilization Treatment Program. Thank you. Thank you. It takes a village to raise a child. It takes a community to successfully help someone overcome addiction. The people you see here today are a snapshot of that community, working together to help people live the best life they can live, the life they deserve to live. But don't take my word for it in how we are helping the community. Listen to the healthcare professionals and the past clients who can tell you firsthand about this program and it's worthwhile and how it's impacted them and it's made a difference in this time of great need. This is a very controversial topic, Section 35 around the Commonwealth. But I'm going to tell you, the results will be yielded out of this treatment center with the help of each and every one of you, our community partners, our legislature, the families, and we will put the best product and the best opportunity for success for our loved ones. That I can promise you. We will yield the results conducive to living a good, law-abiding, but most importantly, healthy, sober life. But first, let me introduce Congressman Richard Neal, the chairman of the Ways and Means Committee in Washington. Congressman Neal, like our Sheriff's Department, has seen addiction change and substance use disorder treatments evolve over the years to bring us to where we are today. Congressman Neal, please come forward.
Thanks, Sheriff.
Thank you.
Thank you. I was delighted that the sheriff said, please come forward rather than step forward. That could be at the other end of the criminal justice system. So I want to thank and congratulate the sheriff, and the legislators and the mayors, council members and others for this extraordinary day. This is a reflection of a series of challenges that we face in America, not the least of which is addiction. When the sheriff has said to me time and again, as another close friend, Mike Ash, used to say, that 90% of the inmates at the facility in Ludlow, that they either had alcohol or drug problems. That tells you the story about trying to find a successful route to rehabilitation. The constituency here is obvious. Everybody knows a family member, somebody down the street, a coworker, a neighbor who has the addiction. We also noted that this is not curtailed by the idea that it's just one age group of young adolescents. This now makes its way into people well into their 60s and 70s, largely because of the overprescribed use of opioids. Last year in Congress, H.R. 6, which was my bill, we expanded opioid coverage to Medicare recipients. 58 million people now have the ability to secure treatment under that opioid bill. In addition, an understanding, as the sheriff noted a couple of moments ago, this is a community issue. And I also think that there's another important consideration here, as the sheriff noted, about controversy. There still is nothing more difficult in urban life than land use questions. How to get people to be accepting of the term community. Because as much as they want to be a part of it, they also see the challenges that come with it. And trying to get them to buy into the solution is a very, very difficult undertaking. So when the sheriff asked if I would stop by today to acknowledge this important occasion, I'm reminded of the transformative effort that the Hampden-County-Sheriffs-Department and others have made over many years. They've changed the way that we view incarceration. They have changed the way that we view rehabilitation. And I think that for all of us here, we should be grateful in the Pioneer Valley to have people like Sheriff Cocchi and the legislators and others that are here with us today. Thanks for allowing me to be part of it. Thank you,
I'd like to bring my good friend and the people's mayor of Springfield, Mayor Domenic J. Sarno, up to bring greetings from the great city of Springfield. Mayor Sarno.
To our Congressman, Chairman Neal, to my friends and mayors, legislatures, to all the people who are on the streets advocating and helping individuals and families out. We all have dealt with this, with family and friends who have to deal with the scourge of drug aspects. And I know the Sheriff Cocchi had indicated this Section 35 is controversial. Not to me. Not to me. It's doing the right thing to help out individuals and families at a second chance at a productive life. And I tell those individuals who say, question it, the alternative is that person might not be around again. So to Sheriff Cocchi, Sheriff Ash was cutting edge Howard Street. I've been there from Howard Street. I see my old friend Joe Gallo and Mill Street fighting to make sure we kept this here in the city of Springfield. Sheriff Cocchi has taken it to the next level. He had the facility. He has the treatment. He's partnered with medical professionals. I know Dr. Kerouac, the president and CEO of Bay State Medical Center. We're very lucky to have Bay State here, one of the top hospitals in the nation, all working together to help those individuals and those families get back on their feet. And to each and every one of you and the service providers, we can't put a price tag on what you're able to give to those families and individuals, giving them peace of mind, because not every day is a good day, but you're helping them get through the challenges. So I will continue to stand shoulder to shoulder with Sheriff Cocchi in this effort, whether it's Section 35, and I'm very appreciative on the federal level with Congressman Neal and on the state level with Governor Baker and our local delegation here. Keep fighting for the funding. I'm going to keep pursuing, working with my Commissioner of Health and Human Services, Helen Carlton Harris, on accessibility to beds, wraparound treatment. And right now, Sheriff Cocchi, partnering with all the medical individuals and establishments, especially Bay State health systems, it's working. And you can't put a price tag on, you're saving lives. So for those, I'll end with this, for those who say that this Section 35 is controversial, I say it's saving lives, and we're very thankful to Sheriff Cocchi and his staff. Good health, and God bless you all.
Dr. Mark Kerouac is the president and CEO of Bay State Health. He's a Springfield native who earned degrees from Amherst College, Harvard Medical School, and received his master's in public health from Boston University. He has been in the medical field for over 3 decades and now manages the largest healthcare system in this part of the Commonwealth, and its health insurance subsidy, Health New England. During his time in the healthcare field, Dr. Kerouac has seen attitudes and methods surrounding addiction treatment shift. He has seen our Stonybrook Stabilization and Treatment Program grow where we are today, and wants to offer his perspective as we look back on 1 year of treatment. Please welcome Dr. Mark Kerouac from Bay State Health.
Well, thank you, Sheriff. It's really great to see everyone here today. I really want to congratulate the Sheriff, all the members of the Hampden County Sheriff's Department, and particularly the staff here at the Stonybrook Stabilization and Treatment Center on this very important 1 year anniversary. This is the kind of innovative and effective program that the opioid crisis now demands. If you look at the statistics of the program, fewer than 5% of people are recommitted. That's a statewide low. The treatment duration is over 45 days, which is a high for the state, and it really increases the effectiveness of treatment. The results of this program speak for themselves, and so I applaud the Sheriff and all the members of the staff for stepping up and taking this issue head on. As you know, opioid overdose deaths have gone down slightly in the state of Massachusetts, but here in Hampden County, we've continued to struggle as more and more lethal opioids like fentanyl have crept into our neighborhoods. At Bay State Health, we've continued to see a high volume of folks struggling with addiction, whether it be through overdoses, withdrawal symptoms, or the various infections that these folks have. In our Springfield Emergency Department, over 1,500 people with substance use disorder were treated just last year. For me, this is a discouraging and difficult challenge, and it's more than just a public health issue. For me, it's personal, because as Sheriff Cocchi mentioned, about 40 years ago, I was a young doctor not wearing a suit, and for 20 years, I took care of patients with the stigma of addiction as well as the stigma of HIV and AIDS when we didn't have programs like this and sophisticated treatments like this. And so this particular struggle with me brings back pictures of people that I've cared for over the years. Bay State, therefore, is doing its part to address this issue. I don't think any one organization or one approach can solve this, but together we can. We've begun to offer medication-assisted therapy with drugs like Suboxone in our emergency department, and have expanded the number of Suboxone prescribers in our clinics at Mason Square, High Street, Brightwood, and the Griswold Center in Palmer. We're working with the Sheriff and with District Attorney Gallooni and the Hampden County Addiction Task Force. Among other things, they've distributed over 450 kits with the life-saving reversal agent Narcan. Bay State Health is proud also to be a leader in research in this area through our Chief Research Officer, Dr. Peter Friedman. We've landed just these last few months a couple of multi-million-dollar federal grants to look at patterns of addiction in rural areas and also effectiveness of treatment in the criminal justice settings. In the future, we intend to expand both our treatment options and our partnerships with important organizations like Stonybrook. We're planning to expand our Suboxone treatment to all our community emergency departments before the end of this year, and to add an addiction consult team to our Bay State Medical Center Hospital to deal with addiction issues for people who are admitted for other reasons. We're partnering with organizations like the Center for Human Development and Bay State and the Behavioral Health Network to make sure that patients discharged have a treatment plan in the community. Ultimately, the treatment of addiction, of substance use disorder, needs to be part of routine primary care. So while we recognize and congratulate the Stonybrook team and the Sheriff today, we all know the work isn't done, and that we're far from having this problem under control. However, with innovative programs like Stonybrook, with great partnerships like the Addiction Task Force, and with the commitment of all of us here today, I'm convinced that we can conquer it in the end. Thank you.
Thank you, Doctor. Before we close, I just wanted to invite someone up to the front. Keith, would you come on up? Keith is a gentleman who we know very well, who came through our program when we first opened, and this month he'll be celebrating 1 year clean and sober. And Keith, at the Sheriff's Department, the Sheriff has something that he calls a challenge coin, and he gives it to us, challenges us to strive for excellence day in and day out. And I'll tell you what, day at a time, watching you over this past year, you emulate everything that this is about. And I want to present you with this on behalf of the Sheriff's Department and congratulate you.
So I was told to say a few words, but there's a lot of people here, so, share the time. Like Anthony said, I was here in the beginning. My last day of using, I was one of those guys who was out there panhandling on the corner. I decided to give it up. I asked an old PO for help, and ever since then, the Section 35 was amazing. Any program that first starts up, it's always rough around the edges. They always keep striving to make it better, and I believe that's what they're doing here. This program helped save my life, because other programs that I went to, I wasn't able to stay. It was an eye-opener for me this time around. I've been to Ludlow quite a few times, but this time was different. And the counselors there were great. Staff was great. Very sincere. I believe that helped my journey. They helped me get into another place after that, and they stayed with me throughout my recovery, which is huge, because, most of these people are wearing badges, and, I'm used to them telling me to lock in or cuff up, Now I get to shake their hand and, come and go when I'm offered to speak and, talk to the guys. I come up here, I try to come up here once a month to try to give hope, because that's what people did to me. There's a better life out there. I hope they don't shut this program down, because I've seen a lot of people who aren't here with us anymore. And, the more programs that are out there, the better chance we have. And with that.
Congratulations, Chief. Thanks for doing that. Okay, just before we close, just really want to thank everyone, all the community providers. SSTC, Stonybrook Stabilization Treatment Center, is the first step. And like everyone, I just want to echo it. It truly is a community effort. And I'd also like to bring up Senator Jim Welsh. Come on and speak on top of the entire delegation.
Good morning, good afternoon, everybody. It's a pleasure to be here with all of you, and it's a pleasure to be here with the legislative delegation who worked so hard this budget season to be able to secure the $1 million to help support this Section 35 program. So I just want to identify those of us from the delegation that are here with us. We have Representative Bud Williams, Representative Brian Ash, Senator Eric Lesser, Representative Jose Tosado, Representative Mike Finn, I know, is here as well. And that's only half the team, really. There's a great delegation, a great team of hardworking individuals that come in and really listen to what needs are in our community. And this is obviously something that is a major obstacle and a major challenge for all of our communities. And I'm just proud to be part of the legislative delegation that bound together, worked together, set a priority, and was able to deliver on that priority to help all of the men and women that are working so hard, not only the people that work here, but also the men and women that are the men that are working so hard, to beat their addiction. So it's great to be part of this legislative delegation that was able to deliver this funding. And again, it's a huge team effort. And I just want to congratulate Sheriff Cocchi for taking the initiative and being a leader to combat this issue that we all have a part of. So thank you very much.
Okay, thank you. Yeah, so in closing, really just thank you, everyone. Thank all our partners. It truly is a community effort. And thank you to all the elected officials for all of your advocacy. Some have been mentioned, but I'm just going to go through the list because you're all such strong advocates for the recovery community and for all these programs. So thank you, Congressman Neal, State Senator Lesser, State Senator Welch. Thank you. Jonathan Gould's here from, I believe, from Senator Adam Hines' office. Thank you, State Rep Finn. Thank you, State Rep Ash. State Rep Jose Tosado's here. State Rep Bud Williams. I believe Pat Duffy's here from Rep Vega's office. Thank you. And, of course, our mayors, Mayor Sarno, Mayor Sullivan from Westfield, Mayor Costa from Chicopee. We really appreciate all of your support and everyone and all the programs. And also, I'd like just to invite the press to feel free to ask at the end of this any questions. Especially, we really appreciate, if for someone to be successful in recovery, there's many paths, but one common thread is no one can do it alone. And all the people that I mentioned are involved in that support team, but also, most importantly, we have a lot of wonderful families here, families of former clients that are here in support of this program. And just thank you for all their support. And please feel free at the end of this to approach any of our former clients or any of the families. Many of them are willing to share their experiences. And also, most importantly, there's some food inside, and even if you have to go grab some lunch before you leave. And I also would be remiss if I close without asking all of the staff, all of our Section 35 staff and all the staff involved in this program, please raise your hand so we can recognize all your efforts. Thank you.
Thank you very much for coming. Please take yourself inside, have some refreshments. Thank you.
Thank you, Sheriff.
Nice job, all right. Very nice. I need this man. After you finish. Okay.